Omicron. Of the 15 cases that found in that country, only 3 had mild symptoms. The rest had no symptoms at all. 0. 11 of the 15 people in Botswana were already vaccinated. Moving to Europe, as of this past weekend, of the 59 cases of Omicron detected there, all were either mild or asymptomatic. And nearly all of those cases, the patients had already been vaccinated. So looking at the early Omicron numbers, this appears to be a pandemic of the vaxxed, not the unvaxxed, right, to use their term against them. We also know from the World Health Organization that although this variant is reportedly present in 38 countries now, 0 deaths have been reported, okay? 0 deaths reported throughout the world. This early evidence, combined with the clear failure of the vaccines to protect you against the Delta variant, is leading some researchers at some very prestigious institutions to believe the vaccines may actually be making matters worse now. Consider this. We have seen more China virus-related deaths this year than before the widespread vaccinations in the country. Europe is trending in the same direction. The distinguished National Research Center of France discovered Delta is becoming a major problem. Here's why, warn those researchers. The current rollout of the vaccines are not perfect. Nearly everyone acknowledges that. In fact, they're far from perfect. Nearly everyone agrees that these vaccines are, quote, leaky, to use the scientists' own term. That's what they like to call it, a leaky vaccination. So why do you think they still now refuse to rule out more lockdowns? Because they know the vaccine isn't protecting us anymore. But they have to push it anyway. Watch.
Can the CDC say with confidence that the president is right and there won't be lockdowns?
You know, here's what I can tell you. We know that the current challenge that we have right now, as we're following what is occurring with the Omicron variant, is the Delta variant. And we know that if we scale up our vaccinations and scale up our boosters, we can tackle the Delta variant.
But we were already seeing that the vaccinations are not working for Delta. See, it's all mixed messages. The president says no lockdowns, and then she offers up the possibility there could be some. Remember, as Blaze writer Daniel Horowitz discovered, we've even reported on this before, on page 52 of the FDA's emergency use authorization for the vaccines, it warned of the possibility of mass vaccinations making things worse with new strains, which is what appears to be happening now. It reads in that emergency authorization document, risk of vaccine-enhanced disease over time, vaccine-enhanced disease over time, potentially associated with waning immunity, remains unknown and needs to be evaluated further in ongoing clinical trials. Remains unknowns means it's a possibility, but sadly the FDA, the CDC, the White House, they all refuse to acknowledge or even consider the fact that the current vaccinations being used may actually be making matters worse. Maybe. I'm not saying it is fact. I'm saying it is maybe, and it certainly deserves more research. Instead, their answer is to call anyone who raises questions a disinformation spreader, while the government resorts to simply pushing more vaccines. Boosters, as they now call them.
You get vaccinated and boosted. You use testing judiciously before you gather. You gather in well-ventilated spaces and use masks. Mm-hmm. Your risk can be quite low, and your holidays can be quite fulfilling.
If you were vaccinated before June, it's time to get a booster.
That third shot with the mRNA not only boosts you way up, but increases the durability.
Go get the booster shot today.
But we know it's not working against Omicron. And we know it's not really working against the Delta variant either. They have given us no data that the boosters are effective. None. They tell us they are, but no data behind it. Look at this chart from the Netherlands, one of the most vaxxed nations on Earth. As the number of vaccinations climbed, so did the number of COVID cases, nearly all of them, okay? The Delta variant. In Denmark, It's the same situation. Yet American health so-called experts are obsessed with vaccinating everyone, no matter what the science tells us. Dr. Fauci finally admitted what they're after here when it comes to max vaccinations.
So what I'm thinking about is control, namely a level of control that is well better than where we are right now.
Level of control, he just wants max vaccinations. Here is another chart. Hospitalizations in Vermont have reached an all-time high, with 99% of seniors fully vaccinated in that state. 65% of them already have gotten a booster. Yet we are warned over and over again that the spread of this disease is due to, well, football fans and the fans the media are angry at for the constant outbreaks. Not outbreaks of the virus, outbreaks of this, of course. Joe Biden! Joe Biden! Joe Biden! Joe Biden! So, truth is, those outbreaks I love. Now, I fear Team Biden and his vaxaholics want to use Omicron to take away from and cover up the vaccine's failure when it comes to Delta and this new strain. So while Omicron is now not a concern right now, it could become one. Delta started off mild too, but then it got worse. Omicron spreads faster. We know that to be a fact. But that may be a positive because doctors all agree most virus variants will spread faster but get weaker with time. It's nature's way of helping us reach herd immunity. But nature didn't take into account the introduction of a, quote, leaky vaccine that may be helping the China virus, maybe helping that China virus unnaturally become more dangerous. Well, joining me now is a member of the GOP Doctors Caucus, Republican Congressman from Georgia, Buddy Carter. Congressman, welcome to the program.
Thank you.
Did I say anything there, Congressman, that you would say, boy, Grant, you're a real disinformation spreader, you shouldn't be asking those questions? What are you talking about?
I don't really think so, Grant. I think there are a lot of questions out there, a lot of questions that we need the answers to, and we need data in order to support it. You know, we have a saying in Washington, in God we trust, everyone else bring data. And that is the key here. And the data that you shared from, I believe it was the Netherlands and another country, that shows us right there that there's a problem here. I mean, let's face it. Joe Biden and Tony Fauci have politicized COVID-19. We've gotten to the point now where you can't trust them. You can't trust them at all. All they're trying to do is control. We went through this with the Obama administration when they tried to take away our private health insurance with Obamacare. Now the Biden administration is trying to take away our private health care choices by mandating that we get vaccines. This is the same Joe Biden who is allowing the border to just be crossed by people who are untested, who are unvaccinated, coming across that border. Yet he wants to have Americans to be vaccinated. This is the same Tony Fauci who lied to Congress and told us that there was no gain of function research going on. These are two people that we can't trust anymore. Tony Fauci, I've called for him to resign. I've called for him to be fired. People in America don't have faith in him anymore. He's not an immunologist. He's a pundit. That's what he is anymore.
All right. So let me play a soundbite from Tony Fauci just recently. Take a listen to this and I'm going to get your response.
Thus far, it does not look like there's a great degree of severity to it, but we really got to be careful before we make any determinations that it is less severe or it really doesn't cause any severe illness comparable to Delta. But thus far, the signals are a bit encouraging regarding the severity.
Now, he refuses to ever talk about natural immunity, but if it's true that Omicron is not severe, that it's causing mild cold-like symptoms, wouldn't that be a good thing if it ripped through the community, giving people a cold and maybe some natural immunity, Congressman?
Well, you bring up a good point. As a pharmacist, in our training, we're taught to ask the right questions. And right now, the wrong questions are being asked. The question being asked, are you vaccinated? When actually the question that should be asked is, do you have immunity? That's the key here. The natural immunity is the key. And that's what's not being asked, that's what's being ignored. And we do need that. And yes, that helps us to build up herd immunity. Now look, as you know, I'm an advocate for the vaccine, went through the clinical trials myself. I think it is safe and effective, and I hope that people do get the vaccine. However, you should not mandate it, and we should be checking for natural immunity. We need to.
Doc, let me ask you a real quick question, Congressman. Do you see signs the vaccine is now not working for some of these later strains?
Not really. It's difficult to say with Omicron because it is right on the scene. It's brand new, so we don't have a whole lot to look at right now. But with the Delta variant, we saw it run through. It was if anything, it was a very rapid run that we saw with the Delta variant. It went through quickly. But aside from that, it's difficult to say that, again, that's why data is so important for us. Physicians, when they write progress notes, they use a method called SOAP. It stands for Subjective, Objective, Assessment, and Plan. And in order to do that, you need that data, the objective data that you need, lab tests, vital signs. We need this data.
It's amazing. They want to vilify anybody who asks for that data, or even when we get data and interpret it in a way they don't like, they vilify everybody. That's not right. Congressman Buddy Carter, we appreciate you coming on. Thank you, sir, as always.